I thought I would just share that one of the early pieces of advice that was given to me before I decided to start down the road of these procedures was that it was a process that would require the discipline of sticking with the physical therapy and recognizing that you would actually have swelling, you would have pain sometimes, you would have some limitations in your motion, and actually, for a period of time, initially after surgery, you were going to be fairly restricted because you're either going to be on crutches or you're for a relatively significant period of time, or you're going to be utilizing a machine that does some movement for you. And so that whole process, if you're contemplating this type of surgery to repair your knee rather than replace your knee, you have to work at it, and it is a process where physical therapy and various special techniques that you learn will benefit you greatly. And you will have days where you'll have more or less pain, more or less swelling, and then all of a sudden you'll have 2 or 3 months where you're doing really well, and then you will increase your activity and you will actually go into a period where you might have some additional swelling. But then all of a sudden it's sort of like you wake up one day and you recognize that your knee is really tremendously better than it was before you started this process. And you then, when you recognize that, you continue your activity, and you'll look back sometimes as much as 6 months intervals, a year interval, and in my case, I'm 5 years beyond my last 5 years plus beyond my last operation, and I'm far better than I've been for over 35 years. And so when you start putting this kind of surgery into perspective, you recognize that this is different. This isn't going in, getting something fixed, walking out, and you feel better. This is something going in because you're trying to fix your natural joint, and in order to get that result, you have to put a lot of effort into the physical therapy and use of the knee in the proper fashion, or the joint in the proper fashion. So it's something that you have to look long term, and you have to think about as a daily process that you're fixing your knee. And if you do that, and you're fortunate enough that the articular cartilage evolves and grows and becomes much more like it was prior to your injury, you'll be happy that you went this route.
Yeah.
Great.
Should we do anything about the insurance stuff too, or just
Yeah, I'd be
in
happy
terms
to.
of he fought and sort of talked to the insurance company a lot. It took a long time, but I think it's another thing too. It's a frustration.
Yeah.
Just so people know up front that it does take some battling and appeals and
Yes.
working at it. Unfortunately,
I probably have I have multiple stories regarding the fighting with the insurance companies, essentially, because I've had 3 surgeries. Again, my first surgery was a major repair, an anterior cruciate repair, a ARCART, which is the articular cartilage pace graft repair, and I had a meniscal allograft. These procedures, other than the anterior cruciate portion, were not routine. This was back in 2001. And as a result of that, there was not even developed all of the codes to have these procedures done. And initially, the insurers refused to pay. And so in those days, you were asked to put up the money for your procedures in advance because there was no assurance that the insurance company was going to cover. Well, now the insurance company sees that these procedures are much more long-term, much more beneficial, and actually result in less surgery down the road. But you have to be disciplined about sticking with the challenges that you'll have with the insurance companies, and you shouldn't look at it like insurance is not going to pay. So for example, my first surgical bill, I believe, was somewhere in the range of $17,000 or $18,000 for the entire procedure, and of that, all but a few $1,000s was paid for by the insurance company. The second time around, I believe, of the range of over $10,000, but I don't remember the exact amount. All but $1,000 or so was paid, and so you shouldn't look at the fact that you have to put some money out of pocket to get rolling on this. If you have an insurance company, you'll be able to get a considerable amount of reimbursement.
Great.
Is that what you're looking for?
Yeah.
Okay.
Yeah. And it just takes time too. I mean, it's kind of
Yeah, yeah, you really do have to
Yeah.
push them.
It's they're
No, I think that covers it. Yeah. Thank you.
Okay,
Really appreciate
you're
it.
welcome.
Yeah, I think that's gonna
You're
be really
welcome. If there's any other